All right, so let's dive into this whole anemia thing that you've probably been dealing with. You know, feeling drained, maybe a little breathless, and then your doctor mentions anemia.
Yeah.
But what does that actually mean?
Right.
Beyond, like, just being tired all the time. I mean, that's what we're here to uncover today. We've got some great expert notes on anemia to go through, covering everything from how it's actually diagnosed to the really, honestly, surprisingly wide variety of ways that it can be treated. So get ready to learn all about your blood.
Exactly.
And how to boost those energy levels back up.
It's a really great question to be asking because a lot of people, when they think about anemia, they think, oh, I'm tired.
Right.
But it's really about how well your blood is working to carry oxygen throughout your whole body. So specifically, anemia means that you have a lower than normal level of hemoglobin.
Okay.
And that's the protein in red blood cells that carries the oxygen.
Ah, okay.
Or you can have a lower volume of red blood cells overall.
So it's like your body's internal transportation system for oxygen is just not running at full capacity.
Exactly.
Like rush hour, things are getting backed up.
Yeah.
And the World Health Organization, the WHO, they actually have specific numbers for actually diagnosing anemia.
Right.
So for men, it's a hemoglobin level below 13 grams per deciliter.
Mm-hmm.
And for women, it's less than 12.
Yeah. And then you start to think, what happens when your body's not getting enough oxygen?
Ooh, yeah.
You feel that fatigue, of course.
Sure.
But you can also have those heart palpitations, right? Your heart has to work harder
Oh, wow.
to pump that oxygen. You might get short of breath more easily. You could even feel dizzy or have trouble sleeping.
Mm-hmm.
It's amazing how all these seemingly very unrelated symptoms can all stem from the same root cause.
It's like a chain reaction happening inside.
It is.
Now, when most people think about treating anemia, they probably immediately jump to iron supplements.
Right.
But I'm sensing it's not that simple.
No, you're right. There's a whole toolbox of treatments out there. And iron supplements are just one piece of the puzzle. We've got iron, of course, both in a pill form and even intravenous options for more serious cases.
Wow.
Then there's vitamin B12, also known as cobalamin.
Okay.
That comes in a couple of different forms. Cyanocobalamin and hydroxycobalamin.
Oh, wow, those are some big words.
They are, which might sound a little confusing,
Yeah.
but we'll get into why that even matters later.
Okay, so iron, B12, what else? What else are we working with here?
Don't forget about folic acid.
Oh, right.
That plays a crucial role. And then there's even more specialized treatments, like erythropoiesis-stimulating agents,
Oh, my God.
or ESAs.
Okay.
They sound complicated,
Yeah.
but basically they act like a signal to your bone marrow, telling it to produce more red blood cells.
Okay.
And then, in some cases, blood transfusions might even be necessary.
So it's definitely not a one-size-fits-all approach to treatment. And speaking of iron, since that seems to be the go-to solution that people think of
Right.
when they think of anemia,
Right.
I bet there's a lot more to this story.
There is. Iron has a fascinating journey through your body. It's mostly absorbed in the duodenum and the jejunum. Those are parts of the small intestine.
I was going to say, I have no idea where those are.
See, we're learning already.
Yeah.
And it gets even more interesting. The iron that we get from meat, called heme iron, is like a VIP.
Okay.
It's easily absorbed.
Okay.
Plant-based iron, which is called non-heme iron, has to wait in line a bit longer.
Oh.
So it's not as easily absorbed.
So if you're vegetarian or vegan, you might need to pay extra attention to that iron intake.
That's right. And there's other factors, too, that come into play. Vitamin C can actually help your body absorb more iron, while things like antacids or even calcium can make it harder to absorb. It's all about balance.
Wow, it's like a delicate ecosystem in there.
It is.
And even when it comes to those kind of familiar iron supplements, it's not just pop in a pill.
You got it.
Yeah.
While oral iron supplements are very common, they can have some unexpected side effects,
Oh, okay.
like stomach issues, constipation, and even darker stools.
Definitely not what you're expecting when you're trying to just boost your energy.
Definitely not something you see in those commercials.
Right, exactly.
Not at all. And then there's intravenous iron, which is a bit more intense.
Right.
It's used when people can't tolerate the oral iron, they have trouble absorbing it, or if they've had significant blood loss.
Okay.
Intravenous iron comes in different forms, each with its own characteristics.
Wow.
But it needs to be administered very carefully because it can sometimes cause serious allergic reactions.
That sounds a little more serious than I initially thought.
Right.
Okay, so we've covered iron pretty thoroughly,
We have.
but I know that there's like other key players in this whole anemia game.
Yes.
What else should we be thinking about?
There's a whole category called megaloblastic anemia, and it's all about deficiencies in vitamin B12 or folate. Now, this is where the science gets really fascinating.
Oh, I love when we get to the fascinating part.
Well, B12 is like this ultimate facilitator.
Yeah.
It helps to convert folic acid into its active form, which is absolutely essential for making DNA in your red blood cells. And without enough B12, that whole process gets disrupted, and then you end up with fewer healthy red blood cells.
So B12 and folate are like partners in crime working together to keep those red blood cells healthy.
Exactly. And then there's this condition called pernicious anemia, which is a specific type of megaloblastic anemia.
Okay.
And in this case, your body can't absorb B12 properly.
Wait, so you could be eating plenty of B12-rich foods,
You could.
but your body might not even be able to use it.
That's right. It's all because of something called intrinsic factor, which is crucial for B12 absorption.
Okay.
And this is why simply treating pernicious anemia with folic acid can actually backfire.
Oh, wow.
It might mask the B12 deficiency and potentially even worsen neurological symptoms.
Hold on. Neurological symptoms. I thought we were talking about blood.
That's the thing about B12. It's not just for making red blood cells. It's a key player in keeping your nerves healthy, too.
Okay.
So a B12 deficiency can lead to a whole host of neurological issues.
Wow.
Like numbness and tingling in your hands and feet,
Yeah.
weakness, problems with balance, even memory problems.
Wow, B12 is clearly like, the VIP nutrient here.
It is.
So much more than just something you grab off the shelf.
Absolutely. And since we're talking about all these important players, let's shift our focus to another one. Erythropoietin, or EPO for short.
Okay.
Most people haven't heard of this hormone, but it's absolutely essential for red blood cell production.
Okay, I'm intrigued. Tell me more about this EPO.
Well, EPO is mainly produced in your kidneys,
Okay.
and it's triggered when your blood oxygen levels are low,
Okay.
a state called hypoxia. Think of EPO as your body's way of saying, hey, we need more red blood cells to carry this oxygen.
So it's like your body has this like built-in alarm system that goes off when oxygen levels drop. That's pretty cool.
It is. And we can actually use this system to our advantage medically. There are medications called epoetin alpha and darbepoetin alpha that are essentially man-made versions of EPO.
Okay.
And they mimic your body's natural EPO, and they tell your bone marrow to start making more red blood cells, which boosts your hemoglobin and hematocrit levels.
So it's like giving your body this helping hand
Exactly.
to get that red blood cell production going. When would these medications actually be used?
They're often used to treat anemia that's caused by chronic kidney failure because damaged kidneys don't produce enough EPO on their own.
Oh.
They're also used to counteract bone marrow suppression that's caused by chemotherapy.
Mm-hmm.
And for anemia that's related to conditions like multiple myeloma and rheumatoid arthritis.
Wow.
They really are a versatile tool in the anemia arsenal.
Wow. EPO is quite the powerhouse.
It is.
Okay, so we've covered a lot of ground here. From iron to B12 to EPO.
Right.
It's clear that anemia is this multifaceted condition.
Yeah.
What's the most important takeaway for our listeners today?
I think the key takeaway is that every case of anemia is unique. And it's like solving a mystery. You have to understand what's causing your anemia.
Right.
And that's the key to actually finding the right treatment.
So don't just assume it's an iron deficiency and start taking supplements.
Right.
Without talking to your doctor.
Exactly. Anemia could have so many different causes, and self-treating can sometimes do more harm than good.
Yeah.
So get tested, figure out the root of the problem, and then work with your doctor to find the best solution for you.
Great advice. Well, we've covered a ton of information about anemia in this first part of our deep dive, but we're not done yet. We'll be right back to explore even more about this very complex condition and how to manage it effectively.
It really is like solving a mystery, isn't it? You know, we've been talking about all these different treatments, but
Right.
the first step is figuring out what's causing that decrease in hemoglobin or red blood cell volume in the first place.
Right. It's like anemia is the symptom, not the actual disease itself.
Right.
So the detective work really begins with, like, what's behind it all.
Exactly, and that's where your doctor comes in. They'll likely start with a complete blood count, a CBC.
Mm-hmm.
That's a standard blood test. It checks your hemoglobin and hematocrit levels. But they might also look at the size and shape of your red blood cells, which can give clues about what type of anemia you have.
So it's not just about the numbers,
Right.
but the actual characteristics of those
Yeah.
red blood cells, too.
And there are other specialized tests, like a reticulocyte count,
Okay.
which measures how many young red blood cells are being produced in your bone marrow. So it's like checking on the factory floor to see if the production line is running smoothly.
I like that analogy.
Yeah.
So depending on what they suspect, your doctor might order more tests to look for things like iron deficiency, B12, or folate deficiency, or even like underlying conditions,
Right.
like
Yeah.
chronic kidney disease.
Exactly. It's all about narrowing down the possibilities until you get to that root cause.
Right.
And once you know what you're dealing with, then you can start the right treatment.
And as we learn, the treatment can be anything from taking iron supplements to those like more complex options like EPO injections or even blood transfusions. It's really amazing how tailored the treatment can be.
It is. It all comes back to treating the individual
Right.
and addressing their very specific needs.
You know, you mentioned earlier that there are two forms of vitamin B12 supplements, cyanocobalamin and hydroxycobalamin.
Right.
I remember you saying we talk about them later, so what's the difference?
Ah, yes, our little mystery within the mystery.
Yeah, exactly.
Well, both forms are effective in treating vitamin B12 deficiency,
Okay.
but there are some subtle distinctions. Cyanocobalamin is the synthetic form of vitamin B12,
Okay.
the kind that's made in the lab. Hydroxycobalamin is the naturally occurring form.
Okay. So one is made by humans and the other is found in nature.
Yes.
But they both kind of do the same job in the end. Essentially, yes. Hydroxycobalamin is actually a precursor to cyanocobalamin in the body, meaning it gets converted to cyanocobalamin once it's absorbed.
So they end up at the same destination,
Yes.
but just take different routes to get there.
Exactly.
Interesting. And speaking of interesting, I remember you mentioning that hydroxycobalamin can also be used to treat cyanide poisoning. How does that even work?
That's a great question.
Yeah.
It's pretty remarkable. Hydroxycobalamin is actually the preferred form of B12 for treating cyanide poisoning.
Okay.
It works by binding to the cyanide molecules in the bloodstream,
Okay.
forming a non-toxic compound that your kidneys can then filter out.
So it's like hydroxycobalamin swoops in and neutralizes the cyanide,
Exactly.
preventing it from causing harm.
Exactly. It's a pretty amazing use for a vitamin.
It really is. It highlights how, versatile
Yes.
and important B12 is in the body.
Yeah.
Speaking of versatility, let's go back to iron for a moment. We talked about how it's absorbed in the small intestine, but what happens after that? Where does it go? Well, once iron is absorbed, it travels through the bloodstream on a protein called transferrin.
Okay.
It's then stored in various tissues, mainly in the liver, spleen, and bone marrow.
So it's like transferrin is the iron's personal chauffeur, taking it wherever it needs to go.
That's a great way to put it. And that stored iron is then used to make hemoglobin,
Right.
that all-important protein in red blood cells that carries oxygen throughout your body.
So it all comes back to hemoglobin in the end.
It does. Hemoglobin is the key player in making sure your tissues and organs get the oxygen they need.
And without enough iron, our bodies can't make enough hemoglobin, which is what leads to anemia. It all makes sense now.
It's like a complex machine with all these interconnected parts working together.
We also talked about how different factors can impact iron absorption. You mentioned that calcium can actually hinder iron absorption. Why is that?
Well, calcium and iron are a bit like rivals competing for the same resources.
Oh.
They both use the same pathways to get absorbed in the small intestine. So if you're consuming a lot of calcium at the same time as iron, it can reduce the amount of iron that your body can take in.
So it's like this race to get absorbed.
Exactly.
And calcium sometimes wins.
That's why it's usually recommended to take iron supplements on an empty stomach, or at least an hour before or 2 hours after meals.
Okay.
That way, the iron doesn't have to compete with other nutrients for absorption.
So timing is key when it comes to iron absorption.
It can make a big difference,
Mhm.
especially if you're trying to correct an iron deficiency.
And on the flip side, we talked about how vitamin C can boost iron absorption. How does that work?
Vitamin C is like iron's wingman.
Okay.
It helps transform iron into a form that's more easily absorbed by your body.
So it's like a chemical makeover
Precisely.
for the iron, making it more appealing to the body's absorption process.
That's why it's a good idea to pair iron-rich foods with vitamin C-rich foods,
Oh, okay.
like citrus fruits or leafy greens.
So it's all about creating the right environment in
Yes.
your gut to optimize that iron absorption.
And now let's shift gears for a moment and talk about blood transfusions.
Okay.
I know we touched on them earlier, but I want to delve a little deeper.
Yes, let's talk about when those might be necessary. Is it a last resort?
Not necessarily a last resort, but they're definitely a more serious intervention
Okay.
that carries its own set of risks and benefits.
Sure.
They're typically reserved for cases of severe anemia, where the hemoglobin level is dangerously low,
Hmm.
or when the anemia is causing serious symptoms that aren't responding to other treatments.
What are some of the risks involved with blood transfusions?
Well, like any medical procedure, blood transfusions carry a small risk of infection,
Okay.
allergic reactions, and even something called transfusion-related acute lung injury, or TRALI,
Okay.
which is rare but serious.
So it's not a decision to be taken lightly?
Absolutely not. The decision to transfuse blood is always based on a careful assessment of the individual's situation and the potential risks and benefits.
I imagine there are, like, different types of blood transfusions depending on what the person needs?
You're right. The most common type is a packed red blood cell transfusion.
Okay.
This is where the red blood cells are separated from the other components of blood,
Okay.
like the plasma and platelets. And that's the type that's typically used to treat anemia.
So it's a targeted approach,
Yeah.
delivering just the red blood cells that are needed.
Exactly. And in some cases, other blood components, like platelets or plasma, might be transfused, depending on the underlying condition.
It sounds like a highly specialized area of medicine
It is.
that requires a lot of expertise.
Blood transfusions can be life-saving, but they're not without risks. It's crucial to have a thorough understanding of the procedure and to discuss any concerns with your doctor.
That makes sense. So how is a blood transfusion actually performed?
Right.
What's the process like?
It's actually a fairly straightforward process. They'll insert a needle into a vein in your arm or hand
Okay.
and connect it to a bag of blood through an IV line.
Right.
And then the blood slowly drips from the bag into your bloodstream.
So it's not like a complicated procedure, but I'm sure it's carefully monitored.
You're right. Healthcare professionals carefully monitor the entire process to ensure the patient's safety and well-being.
So it's not just a matter of, like, hooking up a bag of blood and walking away.
Definitely not. There's a lot of behind-the-scenes work that goes into making sure the transfusion is safe and effective.
And speaking of behind-the-scenes work, where does the blood for these transfusions actually come from?
It all comes from volunteer blood donors.
So it's a true act of generosity.
It is.
People literally giving, like, the gift of life.
It really is. And that's why it's so important to encourage blood donation.
Right.
It's a simple act that can make a world of difference for someone in need.
Absolutely. If you're healthy and eligible, definitely consider donating blood. You could literally save a life.
It's a gift that keeps on giving. And with that, I think we've covered a lot of ground when it comes to blood transfusions.
We have. We've talked about iron, B12, blood transfusions. It's clear that anemia is a much more complex condition than many people realize.
Right.
There's a lot more to it than just simply feeling tired.
You're absolutely right. It's a multifaceted condition that requires a well-rounded approach
Yeah.
to diagnosis and management.
And as we've learned, seeking professional guidance is crucial.
Yes,
Self-treating is never the answer when it comes to anemia.
precisely. Your doctor can help you navigate the complexities of anemia and create a personalized treatment plan that addresses your specific needs.
Well, we've learned so much in this second part of our deep dive into anemia, but there's still more to uncover. We'll be back in a moment to wrap things up and leave you with some final thoughts to ponder. Welcome back to our deep dive into the often misunderstood world of anemia. I mean, we've really gone beyond just feeling tired, haven't we?
Yeah.
We've, explored the science behind it, the symptoms, the causes, and even, like, the wide range of treatments that are available.
It's been quite a journey, I think.
Yeah.
We've uncovered a lot of fascinating information about this really complex condition.
So what does all this mean for you, our listener?
Right.
If you're dealing with fatigue or, any of those other symptoms we've talked about, the main takeaway is this: don't just ignore it. It really could be a sign of anemia, and it's definitely worth getting checked out by a professional.
I completely agree. And it's important to remember that anemia isn't a single disease. It's a condition that has so many possible causes.
Right.
And while iron deficiency is common, it's not the only one. We've talked about vitamin B12 and folate deficiency, chronic diseases, and even certain medications that can impact your red blood cell production.
Right. It's like putting together a puzzle.
Yeah.
You need all the pieces to really see the full picture and understand, like, why you're feeling the way you are.
Exactly. And that's why working with your doctor is so crucial.
Right.
They can take a detailed medical history. They can run the necessary tests. They can consider all those factors that might be contributing to your anemia.
And based on that information, they can develop a personalized treatment plan. As we've learned, treatment can be as simple as like changing your diet, taking supplements, or it might involve more complex interventions like EPO injections or blood transfusions.
The key is to address the root cause of your anemia
Right.
and tailor the treatment to your individual needs. There's really no one-size-fits-all solution.
So if you're feeling run down, don't just, automatically reach for those iron pills. Talk to your doctor, get tested, and work together to really uncover what's truly going on.
Great advice. And remember, the more you know about anemia, the better equipped you are to take charge of your health and advocate for yourself.
Couldn't have said it better myself.
Right.
We hope this deep dive has given you a better understanding of anemia and empowered you to seek the support you need.
Yeah, as you go about your day, here's something to think about.
Okay.
Could there be something other than iron deficiency contributing to your fatigue? We've explored a range of possibilities today, and it's really worth considering all the angles.
Until next time, stay curious, stay informed, and take care of yourselves.